Formation of a spinal nerve. Spinal nerves arise from the ventral and dorsal horns as rootlets. These rootlets give rise to ventral and dorsal nerve roots. The ventral nerve root carrying motor fibers will merge with the dorsal nerve root carrying sensory fibers within or just proximal to the intervertebral foramen to form a mixed spinal nerve. Recurrent meningeal nerves. As soon as the spinal nerve exits the intervertebral foramen, it gives rise to recurrent meningeal nerves. Therefore, they're mixed with both sensory and motor fibers. Some of the branches will travel back through the IVF into the vertebral canal, and some branches will remain outside of the canal. Recurrent meningeal nerve distribution. The outside branch of the recurrent meningeal nerve innervates the anterior lateral aspect of the peritoneum that surrounds the vertebral bodies, and it transmits pain signals. It'll also innervate the intervertebral disc that will transmit pain and proprioception signals, and the anterior longitudinal ligament, and it too will transmit pain and proprioception fibers. The recurrent meningeal nerve branch that goes back through the IVF into the canal innervates the periosteum covering the posterior aspect of the vertebral bodies, the pedicles, and lamina, and it will transmit pain signals. It'll innervate the ligamentum flavum, which will transmit pain and proprioception signals. It innervates the interior aspect of the IVD, transmitting pain and proprioception signals. It innervates the posterior longitudinal ligament, the dura mater, and blood vessels. And with blood vessels, it transmits sympathetic nerve signals so that these blood vessels will respond to signals from the autonomic nervous system. After the spinal nerve exits the intervertebral foramen and gives rise to the recurrent meningeal nerves, it splits into a ventral and dorsal ramus. Dorsal or posterior rami have two branches, a medial branch and a lateral branch. The medial branch of the dorsal rami innervates the zygapophyseal joints in the overlying skin and the spinous processes in overlying skin. Branch of the posterior rami is going to innervate muscles of the back and overlying skin, particularly those muscles very close to the spine. Some of the anterior or ventral rami form plexuses that generally supply muscles and skin of the upper and lower limbs. These plexuses are the cervical plexus, containing spinal nerve roots of C1 through C5 or 6, the brachial plexus, containing nerve roots from C5 through T1, the lumbar plexus, carrying nerve roots from L1 to L4 or 5, and the sacral plexus, carrying nerve roots from L4 to S4. Some of the anterior or ventral rami form intercostal nerves from T1 to T12 nerve root fibers. These intercostal nerves will supply intercostal muscles and the muscles and skin of the anterior lateral thorax and most of the abdominal wall. Naming a spinal cord segment. Every portion of the spinal cord has a name. A section of cord is named for the spinal nerve that arises from it. The portion of the cord that gives rise to rootlets that become nerve roots that merge to make up a specific spinal nerve is designated a spinal cord segment. Naming spinal nerves. Cervical nerves are named for the vertebra they exit above, with the exception of C8. All the remaining nerves between T1 and the first coccyx nerve are named for the vertebra they exit below. Lumbar and sacral nerve roots. The spinal cord ends around L1, L2. Lumbar and sacral nerve roots emerge from the end of the spinal cord. The distance between the origin of the lumbar and spinal nerve roots, where they come off of the cord, to where they exit the vertebral column through the IVF is very long. These nerve roots form a loose bundle of nerve roots called the cauda equina.